Hi, I'm Angelique Wells. I'm a nursing student here at the University of South Alabama, and I will be performing my medication administration skills checkoff. So I'm going to scan my area. Okay. Put my camera back up here. Lord Jesus. Okay, so now I'm going to adjust my area. So make sure you can see that. All right, so first thing I am going to do is make sure I am in a no distraction zone. I'm going to close all doors so that I can focus on preparing my medication for my patient. So I'm going to take my patient order form in my MAR form, and I'm going to compare. So we have Jaguar Jones, MR number 4176352, MR number 4176352. Allergies to penicillin. The medication we're going to be given today is morphine sulfate, 5 milligrams IM every 4 hours as needed for pain. Same thing, morphine sulfate, 5 milligrams IM every 4 hours as needed for pain. Okay, so we are done comparing. So we're just going to put our order form to the side, and we're just going to use our MAR form. So we're going to perform hand hygiene. Okay, we're going to check again. So we have Jaguar Jones. Okay, 4176352. All right, so we have morphine sulfate. The dose is 5 milligrams. So we're going to use morphine sulfate. The vial is 10 milligrams per milliliter. So it is given every 4 hours. It's time to give it. It's been 4 hours. He hasn't had it, and it's needed for pain, and he has indicated that he is in pain. So we're going to make sure that morphine is not expired. Okay, it's not expired. Okay, we'll make sure this is morphine. Yep. Okay, so it's 10 milligrams in the vial. So that means we would need half a mil because we need 5 milligrams. Okay, so we would check with another nurse to make sure that the amount we said we would draw would be correct. Okay, so yeah. So now we are going to begin with cleaning off our vial. Put that to the side. So since it's an IM injection, we are going to use a 3 milliliter syringe, a blunt tip cannula, and a 23 gauge needle. Okay, so we're going to take our syringe, our blunt tip cannula, okay, so we are going to draw 0.5 mils of air before we drop our medications to put in the vial. Okay, so that is half. We're going to take off. So we're going to put this air in the vial. So now we're going to draw up 0.5 milliliters of morphine sulfate. We're going to make sure we don't have any air bubbles. Okay, perfect. So we're going to use the scoop method to put cap over the blunt tip cannula. Okay, so now as you can see, we have 0.5 milliliters, half a mil of morphine sulfate. So now we are going to take our blunt tip cannula off, put that in the sharps container, take our needle, 23 gauge needle, attach it on. Okay. All right, so now we're going to do our second check. So I'm going to take a piece of tape, and we're going to compare our order again before going to the patient's room. So we have Jaguar Jones, We have morphine sulfate, morphine sulfate, morphine sulfate. We need 5 milligrams. So we would have half a mil. We have a half a mil in our syringe because it's a 3 milliliter syringe, so we need half a mil. Okay, so it's given every 4 hours. It's time, and also it's indicated for pain. Well, it's used for indicated for pain, and our patient said he is in pain. Okay. So we're going to take this and attach it to our syringe. So now we are ready to go in the room with our patient. So we're going to take our vial, our syringe, and our MR or MAR. Okay, so alright, so hey, Mr. Jaguar Jones, I am Angelique and I'll be your nurse today and I'll be giving you your medication. Okay, so I'm going to perform hand hygiene. I'm going to put my goggles on, my clean gloves. Alright, so first I am going to start by looking at Mr. Jaguar Jones' armband. I have it here. So, alright, so we're going to compare. So Mr. Jaguar Jones, MR is 417-6352, 417-6352. Allergies to penicillin, Okay, so is there any other known allergies that I need to be aware of, Mr. Jaguar Jones? No. Okay, so we're going to set this to the side. All right, so then I'm going to explain the procedure to Mr. Jaguar Jones. Hey, Mr. Jaguar Jones, I am Angelique, like I said again, and I'm going to be giving you your morphine sulfate injection, which is indicated for pain, and you said that you were in pain. So now we're going to begin our third check. Okay, so we're going to check our vial and our syringe and our MR. So morphine sulfate is what I drew up in my syringe. We need 5 milligrams, which would be half a mil. It's I am given every 4 hours. It is time to give it. It's been 4 hours and indicated for pain, and he said he's in pain. Okay. So now I'm going to perform any pre-assessments that I need to perform. I'm going to raise the bed to working height, and I'm going to lower the rails so that I can perform my injection. So now I am going to assess for any skin integrity. Okay. So then I am going to clean the site in a circular motion so I'm not going over the clean spot that I went over. Okay, alrighty, so morphine. Okay, so this injection is injected into the ventrogluteal site. Okay, so first we're going to spread the skin. Take the top off here. So we're going to spread the skin. Okay, I'm going to give it at a 90-degree angle. Okay, it's going to be a quick stick, Mr. Jaguar Jones stick. We're going to aspirate to see if any blood, and we'll make sure we're not in the vein. Okay, it's not. So I'm going to administer the medication, take this out, put this in the sharps container. I'm going to take my alcohol pad, hold it on the site to make sure that there's not any bleeding. Are you okay, Mr. Jaguar Jones? Okay, you're okay. Okay, so the site is okay. So I'm now going to take my gloves off. Alrighty, so I'm going to reassess in about 30 minutes to make sure there's no allergic reactions and that the patient is doing okay. Like you said, you're okay, Mr. Jaguar Jones. Okay, so I'm going to, before that, I would have lowered the bed into the lowest position, and then I would have raised the rails back up. And then I would have, after that, I would reassess in about 30 minutes to make sure the patient isn't having any allergic reactions and to make sure that he's okay. And then I would document my 7 rights, the time I gave the medication, and how well the patient tolerated the procedure. And so that is all. That concludes my medication administration checkoff. Yeah, thank you.